Stroke is a serious and life-threatening condition in which blood vessel disorders in the brain cause the sudden onset of symptoms. It is one of the leading causes of disability and death in adults. Stroke is the result of permanent damage to a part of the brain due to inadequate blood flow and loss of oxygen supply. This may be caused by blockage or rupture of a blood vessel inside the brain. The part of the brain which is damaged dies and can no longer function. Risk factors for stroke include smoking, high blood pressure, diabetes, heart disease, obesity, and heavy alcohol use. Age and a family history of stroke also increase a person's risk of stroke. There are two types of stroke: ischemic and hemorrhagic. Ischemic stroke is caused when a blood clot blocks an artery in or leading to the brain. It is the most common type of stroke and accounts for nearly 80% of all strokes. Blockage is triggered by the buildup of plaque in an artery due to atherosclerosis. Other causes include abnormal heart valves and a history of heart attack, or rarely, blood clotting disorders or traumatic injury. Atherosclerosis is the hardening of the walls of the arteries and the narrowing of the space inside them due to the slow buildup of plaque inside the arteries. Plaque is made up of deposits of fat, cholesterol, calcium, and other substances circulating in the blood. Plaques are of two types: hard and soft. Hard or stable plaques have a relatively thick covering and cause artery walls to thicken and harden. Soft or unstable plaques are more likely to rupture without warning. When a soft plaque bursts, it triggers the formation of a clot in the artery at the site and restricts the flow of blood drastically, and may cause a larger blockage in the artery. When a blood clot that is formed in the brain blocks an artery, this type of stroke is called thrombotic. A clot formed elsewhere in the body can also dislodge, travel to the brain, and block an artery there. This type of stroke is called embolic. Hemorrhagic stroke is caused by bleeding from the ruptured blood vessel in or near the brain. Bleeding inside the brain is called intracerebral hemorrhage. The bleeding results in a sudden increase in pressure.
Discover more at Focus App Store, the simple way to explore science and medicine.